So this one muscle is going to keep you stiff, and that's what we're going to talk about today. The one muscle that we're going to talk about is the lats, and it can keep you stiff in the shoulder, but it also can keep you stiff in the back. And here is why. If we look at where the lat is, it comes up where our shoulder blade is, comes all the way down and attaches even into the pelvis down here. This is why it can cause issues in the back, but when the other part of the attachment comes up and attaches into the arm, so it actually internally rotates the arm, and when it's shortened, if you can think about it, it's going to extend the back. And this is a problem, and this can cause problems in the shoulder for some people, and this can cause problems in the back for some people. So today we're going to talk about how we can assess this and one stretch that will really help to open things up. So the big thing that we do when assessing this, that you can kind of do a before and after, because in our office, we really like to do movements before and movements after. And one of the big things that we talk about in our office is we've got to look at mobility before we can even get into stability. And that's why a lot of my videos are about mobility. And there's joints that can keep us tight, but there also can be muscles that can keep us tight. And so in this case, this would be a muscle that's been shortened on the one side. Maybe from positions and postures that you've been in, how you use your body repeatedly. A lot of things can cause that lat to tighten up. So the one stretch that, or the one assessment that we like to do when someone has an issue like this, just to kind of get a before and after, is internal external rotation. Because remember, the lat attaches in through here from the back. So if it's tight, it's going to kind of pull you in. So you may have issues with doing rotation of the shoulder. So really looking at what this rotation looks like. How does it feel? Does it feel tighter than the other side? So like this side may be looser than the other side. And so that's what you're kind of wanting to see and wanting to test before doing this exercise. And so when you have that baseline and kind of have that feeling, you have it in your head, then this is a stretch and this is how we're going to do it. So you're going to take like a door frame. And what you want to do is you want the palm to be turned down so that we're basically allowing this all to kind of stretch through here. You'll grab your hand through the door and you want it to be about 90 degrees. Now your feet, so if I'm going to do my left side, what I want to do is step back with my left leg a little bit so we can get a little bit of balance and we'll be able to add a little bit of rotation. When you're going to go and you're just going to round out the back through here so that you can really stretch all through this part. And as you round it out, you're going to take a deep breath and we're going to actually do a slight rotation. It's not a lot of rotation, it's just very slight. So as I take a deep breath in, I'm rotating and flexing at the same time. Deep breath in. And what you're trying to do is you're really trying to imagine this whole side extending. And you're going to do about 5 rounds of breaths like this. And you're just going to feel it elongate. You're going to feel it in the shoulder, you're going to feel it in the low back. And so as you do that stretch, again, you're going to do it at about 5 breaths as you reach in, as you're trying to really arch, round out that back and really add that rotation as you're breathing. And this is going to open up that side. And what you'll notice after you do about 3 rounds of those, 5 breaths, 3 rounds or so, you're going to notice that your range of motion in the shoulder, it actually might feel a little bit better because there's a lot of tightness that happens when with that area. The other thing that it's going to do, because we're also stretching that muscle, we're also getting the ribs to expand and contract, to expand and contract. So it also gets those joints that moving while we're stretching those lats, which is huge. If anyone ever follows me, the ribs have a lot to do with our shoulder. They have a lot to do with our back. They're a missing piece that a lot of people do not understand and do not put that as a piece of the puzzle when looking at people's issues that they're having in their body. So my name is Stephanie. I'm with Empower Physical Therapy, and we help clients all the time get their life back without injections, medications, or surgeries. That's our specialty. So make sure that you subscribe to our channel because we always are providing content, updating this channel all the time with education to help you understand your body better and to help you understand how we can link things together. So make sure you subscribe, and we'll see you next time.